Brings us to the end of this week's Prime Minister's Questions, coming up to 20 to 1. Angela Rayner was standing in for a man called Keir as she told the story of why he was self-isolating. Boris Johnson actually said, I don't understand why he's not here since he had the negative test back for one of his family members. I'd like to introduce our guest, Justin Madders, Shadow Health Minister, and Gillian Keegan, an Education Minister, and Laura Kunsberg, the BBC's political editor, is still here. It was very sombre in the House of Commons, partly because, of course, it's empty, but it seemed particularly so today.
I think it was there's serious questions being asked at the moment about where next for coronavirus. People are very worried about the rise in cases. A lot of people are very frustrated about the problems getting tests. And, there's not very much to have a laugh and a joke about. That said, Angela Rayner did manage a couple of good gags in a sort of her first outing in this particular contest at the dispatch box. She certainly, announced herself. Really solid performance. Didn't look like she'd never done it before. And I think the gag that will get some of the sketch writers going was her joke about the next time someone drives from London to Durham, they'll be going for a COVID test. Of course, her crack at the expense of the Prime Minister's advisor, Dominic Cummings.
And Barnard Castle. Let's talk about testing, because that is at the forefront of everyone's mind. And, of course, there's been an increase in demand, Gillian Keegan, but you were warned that you needed to spend the summer improving testing and tracing ahead of schools coming back. Did you?
Well, yes, we've improved testing and tracing. We've improved the amounts of tests available. We've had a 100-fold increase in the amounts of testing capacity available in the last few months. We've got 400 test centres all around the country. We're going to have 500 by the end of this month. It's a continuous improvement, and it's actually a very complex logistical and technical, highly technical system. So actually, when you look at what it takes to do this, I think we've done a good job of getting a lot more testing capacity available. And as the Prime Minister said, we're now testing more than any other country in Europe per thousand of the population. But are we done? No, we're not done.
Right, but
we're not.
None of this matters if you cannot get a test today, and you cannot get a test now. The papers are full of pictures of people queuing up at test centres that are closed. We have MP after MP yesterday complaining of constituents having to travel hundreds of miles, despite what the Prime Minister has just said about the average distance needed to travel. If you can't get a test, you don't have to travel anywhere.
Well, of course, anybody who can't get a test, anybody who's stood in a queue, we are absolutely working flat out to try and improve the system for them. 90% of people get a test and get their results the following day. That leaves 10% that don't. 10% is quite a lot of people when you're testing 300,000 a day, which is obviously why you're seeing some of these stories. And of course, we're not going to stop until we have the right, adequate testing capacity. This is a difficult thing to do, to get this testing capacity in place.
But there has been time, hasn't there, Gillian? I'm going to come to you, Justin, in just a second. There has been
increase. That time's been used wisely, Joe.
Right, but
a 100-fold increase is massive.
Right, but there has been time to deal with the unprecedented rise since schools reopened. You are an Education Minister. What discussions did you have with the Department of Health about improving testing capacity before the start of term?
Well, there has been improvements in testing capacity. There has been improvements every day.
What discussions did you have with the Department of Health?
Every school has a test, a number of tests. There's more tests, actually, that the Department of Health have been allocating to schools and colleges and universities in particular. So those are ongoing all the time. There's a lot of people working on making this system improve this system on a daily basis, and it does improve every day. But of course, there is unprecedented demand. It's not just people going back to schools; it's people going back to schools and people going back to university. But still, we've got to remember that the system that we've got in place relies on only those with symptoms coming forward for a test. That is going to be much more difficult. We know this as well as we come into winter, because there'll be seasonal symptoms that kind of are the same in some ways as coronavirus.
Right.
So we are doing a lot more. There's a pilot in Southampton on the saliva test. We're spending £500 million on that. That's a completely different system, logistically much less complex. Let me
bring in Justin. What do you think of what you've just heard? Are you convinced?
I'm afraid I'm not. I think what the country needed to hear from the Prime Minister today was that he understood the scale of the problem and that he was working on it to find a solution as soon as possible. And I don't think that we got that. We got a reel of statistics about how we were doing better than many other European countries. That's not actually accurate either, because in terms of our comparison per head of population compared to Denmark, we're doing less than half the numbers they are. And actually, it doesn't matter if we are doing better than other countries or worse than other countries if people cannot get a test. And that is the number of the problem. We're hearing people in the health sector, in the social care sector, in education, people who are absolutely vital to get this country up and running again, unable to access tests. And I don't know where this figure of increasing 100-fold has come from, because we were at 100,000 tests back in May. You will recall Matt Hancock making an awful lot of fanfare about how they managed to get up to 100,000 in a month. So the fact that we're only at 370,000 now, 5 months later, says that they haven't really been putting the effort in to scale up as was needed and as should have been anticipated.
Gillian?
100,000, the 100-fold increase is from March, so that's just to clear up the figures there, and it's accurate. You cannot say that we haven't been putting the effort in and then see a 100-fold increase in a highly complex, highly technical, highly logistical system. It just doesn't make sense. Of course, those achievements have been made because thousands of people are working on, in the private sector, in the public sector, in our NHS, across government, are working on making this system improve all the time. It will improve, and hopefully, you know, we'll get more tests.
All right,
we'll
Gillian, can I just interject
But
here?
of course, it's not perfect. But 90% are getting the results the next day.
Can I just interject, because you say it's very difficult, it's very complex, and it is, and we understand that. But then, is it really the right strategy for the Prime Minister and other ministers in the government to talk about world-beating systems, to talk about targets of 500,000 by the end of October, to talk about an app that never actually then came online when it was supposed to, and now have the ambition of Moonshot with its 10 million tests a day? Because clearly, in many people's minds, that's not achievable and they want it to work right now. Should the communications change around this?
You've got to get the balance right in things that you haven't actually done before. And, you know, these are new things for our country. You have to get the balance right between setting an ambitious target, because you need lots of people in the private sector, in research, in the public sector to work together to achieve those targets. So you've got to get the balance right between setting those targets and obviously, you know, the actual grind,
delivery,
the logistics of actually delivering them. Of course, some of these targets rely as well on some shifts in some of the technology. And, you know, obviously the saliva test is a game changer if we can get that working at the higher level of accuracy. But yes, I think you have to set targets.
All right. All right,
you know, and you have to deliver against them. We're delivering against the targets. Of course, you're never going to deliver as much as everybody wants you to do, because everyone wanted everything here in March. We would have loved it all to be there.
Right. I mean, in terms of way and why, rather, it's not working, Labour has criticised the role of private companies, private laboratories being involved. We've just heard there from Gillian Keegan that this is a sort of public and a private endeavour. But Jonathan Ashworth, the Shadow Health Secretary, said that he is against Deloitte, Serco, G4S doing the tests. Is that your view?
Well, look, we can only judge them on their performance, and clearly there's something very seriously wrong when people are being directed hundreds of miles away from their own homes, yet we have empty testing centres just down the road from them. Why is that happening? It can't possibly be a system that's intended to work that way. And we know from the start there was a strategic decision to open up these mega labs, actually bypassing NHS facilities. The BMA at the time and ourselves at the time said that was a mistake, and it's very clear that that is coming back.
So do you want those companies stripped of their contracts and for all the testing to be carried out in the public sector?
Well, we wouldn't be in this position if we were in charge, that's for sure. But clearly, they're working on the systems now, so they've got to get on and sort it out. And that's really what we want. That's what the whole country wants.
Well,
we want the system working properly so people can get a test when they need it, because if doctors
so
and
it's
nurses
hindsight.
can't get tests,
It's hindsight here. If you don't want to strip these companies, if you're not actually saying let's revert to the public sector wholly for delivering these tests as we stand now, it is a sort of ideological point that you're making.
No, it's a practical point as well. It was a point we were making at the time. Look, these companies have been tasked to set up the systems. Clearly, they've been putting a lot of effort in, but there are very serious basic problems that should have been sorted started a long time ago, and the surge in demand that we've seen in recent weeks should have been anticipated, and really it's the government's job to get a grip on it. It's no good us blaming private or public sector. It's actually about basic competence, and the government have to deliver on that.
One of the suggestions, in fact we heard it from Matt Hancock yesterday, is about prioritising people. Gillian mentioned it too. People shouldn't be going unless they've got symptoms to get a test. But we also heard from the Health Secretary, I can't remember exactly when it was, weeks ago, saying if you are in any doubt, go and get a test. Is there going to be some sort of eligibility rule?
I think that in the next couple of days, perhaps even tomorrow, we will hear from the government some kind of prioritisation strategy. In other words, I think there will be some kind of mechanism to try to control the demand, because clearly what has happened in the last couple of weeks, with schools going back, more people going back to work, there has been a real surge in the demand, and the government is going to try to manage that in some kind of way. The problem is that there are already people all over the country who are having in their personal lives real-time frustrations, going along to a centre, being told they can't get their appointment, or it's not happening, or not being able to find one online. This is a huge problem for lots of people all over the country. And whatever the government sort of may say or may not, people are experiencing this right now. You know, there have been problems with the testing system from the start because it was developed at a million miles an hour, as Gillian Keegan was defending it. You know, this didn't exist 6 months. It does now exist. But people all over the country, we're hearing it all the time, MPs are hearing it all the time, are having real problems with this right now. And the government's message on it has changed on lots of occasions. So trying to prioritise it from tomorrow onwards, well, we'll see if that comes, but that may be, again, very difficult to manage.
Right. Do you support the idea of prioritising people who can get a test, Gillian, from tomorrow?
Well, we've always had prioritisation. If you remember at the beginning, it was only NHS workers, then
so
it was
we're going back to
NHS
that.
workers and care workers, then it was other people who had symptoms. No, we're not going back to that, but there's always been your demand and your supply have to match, otherwise you end up with people.
Well, how are you going to
queuing.
prioritise it then, Gillian? Because you've just said at the beginning it was going back to health.
Prioritisation. It is in place today. It is in place today, which is only go for a test, only book a test if you have the symptoms. And we know there's lots of people that are booking tests who don't have symptoms. So it is there today.
Right,
It is
within people, within groups of people. If, as you say at the beginning, quite rightly, it was focused on patients and staff in healthcare. I mean, do you think there is going to be a return to something like that? And if so, where will children and teachers go?
Well, I wouldn't imagine, because we've got a 100-fold increase in testing capacity. That's a lot of additional capacity. However, we do have 65 or 6 million people. So clearly, we've done 20 million tests already. Right, so we haven't tested everybody. If everybody wanted to test tomorrow, there isn't enough capacity. So we do have to have some, perhaps simpler and more, clearly communicated to say, if you haven't got a symptom, and maybe reminding people what the symptoms are. But if you haven't got these symptoms, then don't go for a test. We've all been self-isolating without tests as well, people coming back from quarantine. We have to learn to live with this virus.
But Minister, the Health Secretary has been saying for the last few days, if you don't have symptoms, please don't go and get a test. There is a suggestion, though, that GPs may be asked to refer people for tests. You might have to get permission from your doctor in order to go and get one. Would you like to see that? Would that be a good way of controlling it?
I mean, that's not for me to say. I mean, certainly it would add another stage in the process, but I don't know whether it's necessarily a helpful stage or not. I mean, I'm sure there's people working on this right now, looking at how we can, best have a process that means that people who need access to a test get a test, and those that don't understand that they don't actually need a test. So I think there's probably some consideration of that, because right now there's clearly more people think they need a test than perhaps.
Well, Gillian's not sure whether that would be helpful if you had to get a referral from a GP. Would you support that, Justin?
I think I'd be quite concerned about that. We know there's massive pressure on GP surgeries. Anyone who tries to ring for an appointment in the morning has trouble getting through. And clearly GPs are not going to be able to do much more than have a very cursory conversation with people before they refer them on. It's actually the case at the moment. The government website asks if you have symptoms as part of the process to get a test. So I haven't seen any evidence to suggest that people are asking for tests when they don't have symptoms. I mean, why would someone spend all their day refreshing on a website to get a test that they don't actually need if they don't have symptoms? It's simply a cover to excuse the fact that the government haven't anticipated the demand.
I mean, Matt Hancock, the Health Secretary, has said that there was evidence of people booking tests to go on holiday, or when they came back from holiday, or perhaps when they were returning to their workplace, even if they didn't have symptoms, just so they could be sure?
Well, there may be a bit of that, but of course we're in the middle of September now. The holiday season is over, and I think the idea of prioritisation is probably something that we're going to have to do. But at the same time, as we hear the government talking about 10 million tests a day, it sends a very, very mixed message to the public about what actually the priority is, and it gives the impression the government aren't in control of events.
But would you support some sort of eligibility, a stricter line of eligibility that did mean that tests, if they were short or there was a shortage in certain parts of the country, Justin, that they would go to healthcare professionals first?
Yeah, I think that's almost inevitable, and I think that we're going to have to see that with their education as well. It's a sad state.
Hang on. So you want to see it first? Because let's just show everyone the Daily Telegraph here, and this is about who would be at the front of the queue, to use that slightly brutal phrase. Testing chaos puts children at the back of the queue. Would you be happy with that?
Well, I think we've got to look at the implications of that. If a child is sent home because they've got symptoms, it usually means that part of the year group at least has to be sent home as well. Parents then have to take time off work. There's a very, very quick knock-on effect in terms of that, and you will see all parts of the economy suffering as a result. So there's got to be a much more focused approach to this.
Gillian, that Telegraph story, is there any truth in that testing chaos, as they call it, would put children at the back of the queue?
Well, children have gone back to school. Schools have tests, so they've kind of, already been given a small number of tests.
How many tests a school? I understood anecdotally that it was only about sort of 10 tests per big secondary school.
It's a small number, and there's actually additional tests that are being made available, so there's discussion now about how they're going to be allocated.
Would you be cross as an education minister if you found that children and teachers were at the back of any prioritisation?
I don't think we should be prioritising by groups of people. I mean, the reason in the first place when we prioritised NHS workers is because they were there helping those in hospital get well. Clearly, the number of cases being hospitalised is obviously a lot lower now, which is fantastic news. But, there's no case for prioritising individuals by individual groups. It's about us all sensibly using a valuable resource which has grown 100-fold, which will need to grow more, which we've got many people working on growing more, but just to treat it, in the right way, because we simply do not have enough tests for everybody to go out
Gillian,
today.
Let me give you an example. There are 300 schools closed or partially closed. Let's say that one child in one year group does test positive. Would you be unhappy then if the year group was sent for testing? Otherwise, the whole year group has to go home or the school has to close.
Guidelines actually say those in close contact. So the way that schools have organised themselves, it's those in close contact. Now, what's close contact in coronavirus? It's, within a couple of metres space. We have, we don't count close contact, somebody who's a couple of metres we walk past quickly in a shop, for example. So close contact, and schools have been very good at organising so that they minimise the close contacts for pupils.
So not the whole year group, but actually, Laura, whole year groups have been sent home because they're sometimes in a bubble together, a whole year group.
Well, that is also what's happening. So individual schools and, of course, individual workplaces, individual colleges, universities, people are obviously taking their own decisions about exactly what should happen here. And we've heard anecdotally, and this is there's so much evidence and concern here. We've heard anecdotally of people being asked to show negative tests, evidence of negative tests to school before they're allowed to send their kids back. I think the point here is, number one, there is clearly intense strain on the system that is causing a lot of frustration. But what's sometimes getting lost here is just how important this is, because this is completely crucial, which the government has been saying for months, to getting the economy back to normal, to getting education back to normal. And if the testing system is creaking and groaning, as it obviously is, that has huge consequences for returning life to anything like normal. And of course, for controlling the spread of the disease, which is on its way back. And that's why all of this matters so much, however much politicians want to fight about the individual statistics.
All right, let's go to Fact Check Joel, who was listening to Prime Minister's questions, and he's been checking out the claim and counterclaim on weekly testing of care home staff.
That's right, Joe. Boris Johnson said at PMQs that, to the best of his knowledge, care homes in this country should be getting weekly tests for all staff members and tests every 28 days for residents. I've been trying to get through to the people that represent care homes in England. I have spoken to Nadra Ahmed. She's the executive chair of the National Care Association, which represents small to medium care providers in England. She told me that the availability of tests is better than it has been, but it's not consistent. And she said that there are still some care homes that are struggling to get tests. She also said there are two big issues. One is getting the tests in the first place, and the second one is how quickly those tests are turned around. And they're both very important. So picking up on her point about speed, according to the most recent government data, in satellite test centres, which they're called in the jargon, and these are often in care homes, only 7.9% of tests in the most recent week are turned around in 48 hours. So as I say, Boris Johnson said that the government has delivered on routine testing in care homes, but it seems that that's not quite happening as frequently or as quickly as people in the sector would like.
Gillian, your response?
I think the facts are that the quickest turnaround tests are from the drive-through centres. I think the ones when you go to a testing centre, 90% of those are the next days. I think a lot of the care homes are possibly using the mobile satellite centres, which possibly may be a little. But
7.9% of care homes getting the results back in 48 hours. Is that acceptable?
No, of course not. None of this is acceptable. Nobody is sat here saying this is acceptable. Every single day we are working to improve this system. I think if you look at the past improvements, you should be quite optimistic that we will be able to improve them in the future, because it has been delivered. Unlike, obviously it's very easy to sit there and say what should happen, but we haven't let ideology get in the way delivered. We've delivered it.
All right, we've only got a few seconds left. What do you say in response to the figures on the turnaround in testing in care homes?
Well, the first thing to say is that the government promised regular testing in care homes by the first week of July. So the fact we're in the middle of September and it's still not happening is a real problem. But the average time now for care homes to get their results back is 83 hours, which is obviously 3.5 plus days, which is clearly way beyond anything that the government were promising. And that's really got to be sorted as well.
Again, would you like to prioritise care homes?
I think we've got to look at everything, haven't we? Clearly, there's got to be a system that actually matches the priorities as a society.
Well, but what are those priorities, Justin? That's the whole point. We've just heard the minister saying we can't get a test to everyone all the time. So would you prioritise care homes over other groups?
Well, look, we would be very happy to sit down with the government and go through all the different groups and prioritise them according to demand. The main thing, of course, is actually we need to get more tests. And that's something that we haven't really heard any answers on today. All
right, thank you very much for joining me. We are going to be back tomorrow, Thursday. I'm not going to be here, but Adam Fleming will be sitting in the hot seat. Thank you very much to you, Laura, and to Gillian Keegan for joining us today on Politics Live. Bye-bye.